sickle cell disease is characterized by these vaso-occlusive crises in chronic anemia, but that of course affects the quality of life severely, but that's not it. There is a chronic and gradual development of organ complication going on in these patients, which really also negatively affect their quality of life, but also life expectancy. And that's due to a combination of this intravascular hemolysis and microvascular occlusion, resulting in a vicious circle of increased oxidative stress, inflammation, activation of red blood cells, neutrophils, and endothelial cells. That means that patients at a very early age have organ damage of, for example, the kidneys, the liver, heart, lungs, but also cerebral damage. For example, patients have a chronically challenged perfusion of the brain due to anemia, of course, but also due to disturbances in the auto-regulation of the cerebral vasculature, and also the cerebral vascular reserve capacity is very limited, rendering these patients susceptible to ischemic damage of the brain. And so if you do an MRI in these patients, you will see a lot of silent cerebral infarcts. And these infarcts have been shown that they decrease the cognitive function of these patients. And so a very devastating disease with gradual and ongoing organ complications of almost all organs are at risk. And that happens, has been also shown that it can happen despite, for example, chronic transfusions. And so again, I think a treatment that really stops this treatment at the core, which is stem cell transplantation, that would benefit patients much more.